All right. So this is the video for testimonial, and before Dr. William shares his experience, I'm gonna show the audience what he looked like before, and then after one surgery and after two surgery, you can see the difference in terms of volume and density as well. And then we soften the hairline and clean it up while working toward the back. And this is before surgery, this is after a year later, and you can see it's 100% by FUE, and you see the framing of the face better, and it looks, yeah, and it really brought back his handsome look and his youth as well. And and then this is the second surgery, a year after second surgery. You can see there's a lot more volume, there's a lot more density, and then we softened the hairline a little bit just to give a more natural feel for it, and it looks great. So. And Dr. William can share his experience again, compared to the first surgery as to the second surgery as well. Why don't we start? Okay.
Sure.
So, what do you think about the first surgery, second surgery, and
Yeah.
Go ahead.
Yeah, the first surgery, I did as much research as I could to
Uh-huh.
learn about FUE and other options,
Uh-huh.
and I was pretty interested in FUE,
Uh-huh.
and obviously had a great referral to see you, Dr. Diep.
Thanks.
And so after seeing a lot of the pictures, testimonials, and some of the pictures, I had a lot of trust in everything that I was going to go through. So as a surgeon myself,
Uh-huh.
kind of knowing what might to expect with a surgery, I was
Mhm.
still not totally aware of the experience, but so afterwards it took some recovery, but I was very pleased, after some time.
Uh-huh.
And then I went into 1-year follow-up,
Uh-huh.
and I was very happy with everything, but I think you even saw some of the aesthetics that I maybe didn't realize myself.
Uh-huh.
I thought I was
I'm a
going to,
perfectionist though.
Yeah.
I'm gonna come take a line. Go
I
ahead.
always think I need the bald spot fixed in the back of my head, but
Uh-huh.
was really not the same as the overall aesthetics
Uh-huh.
of the framing of the front and softening the hairline and all of those details. I thought that was really important.
Uh-huh.
I think the other really important thing was preserving the donor site. So
Uh-huh,
being able
yeah.
to have another option for a second type of surgery, and that second surgery is really what did the density and helped with the crown and really made a difference. So I think
Mhm.
knowing from the outset, really, 2 surgeries really is the way to go.
Mhm.
And second surgery was, for me, a lot easier to go through.
Yeah.
And it was just knowing the experience, but on top of that, there was just something about the whole experience. It was less discomfort. I was able to sleep a little easier, and
Mhm.
I think I knew when to expect everything too, and so I was very pleased.
Thank you. So, when, as compared to the first surgery, how's the growth rate? Is it the same? It's around 6 months you see the difference, or is it faster? Is it a little bit slower?
I think most people would say that they notice a big difference when the front of the face and the frontal hairline is
Uh-huh.
restored. I think that's the biggest difference initially, but
Uh-huh.
I'd say that I went through having my head completely shaved, and then I
Uh-huh.
could see everything sort of grow back.
Uh-huh.
And so when I got to really around the 4th month, I could see a significant change.
Okay.
And so that was really for me about month 4, where
Uh-huh.
everything was really coming in very dense.
Okay.
And really at 2 weeks, I could walk around like I had a very short haircut.
Uh-huh.
But then the follicles would sort of fade and then regrow, and at 4 months, it was really the new hair that was
Beginning to grow.
solid. Yeah.
Yeah, 6 months and a year time.
Yeah.
But you're
But
lucky.
even 4 months was still
Still
pretty
good.
Yeah.
Okay, good. And you're lucky as a surgeon. You get to wear a surgical cap, so you can hide it
Yeah.
well.
I think even at 2 weeks, I was still walking around sometimes
Mhm.
without it. It didn't bother me.
Okay,
Yeah.
good. Yeah, and again, we chose the FUE, and it's a good choice because it's minimally invasive surgery, and we don't really cut you open. We just extract as well, and just like for your type of work, right? Robotics and laparoscopic, right?
Yeah.
There's no cutting.
Yeah.
Mhm.
I think the other time we talked about it, the scar is actually measured in size bigger with FUE than a strip, but the healing was great. My
Mhm.
wife took care of me, really taking care of bacitracin and all the ointment and all that stuff, and so she saw the healing and she said, "Wow, this is amazing how the healing happens with all of the small
Oh.
pokes for the FUE."
Yeah, and the healing for FUE is a lot more pleasant than FUT. There's less pain, faster healing, right? And the scar is minimal. And the difference between my work and a lot of other clinic or outside the country is they trying to talk about 4,000 graft extraction with the FUE or 5,000. And those number, you have to be careful. It's not like in the United States, we tend to do 25, maybe max 3,500. And there's a border, sometimes a little bit more, but it depends on the head. But on average, we always book for 25 to 3,000. And that's the main reason, is for the patient's safety. Because if you're trying to right out the bat trying to extract 4,000 graft, you over harvest and you don't leave any tissue undamaged. So then basically you over harvest, you damage the tissue too much, and there's a point of no return. And then people walk around with a large patch of baldness in the back.
Yeah.
So how we do it, and again, the judgment of the surgeon is an experience, is to extract and how efficient that is. But we want to leave a lot of tissue to heal, and so we can always go back to do multiple surgery. And then your donor will still look very presentable. Walk around, you don't look like have bald patches in the back.
Right.
And that's the main key, preserving your donor for the future as well.
Yeah.
So.
No, I think when you're getting a surgery that you're going to live with for the rest of your life, you want to look for someone that you can put trust in and a technique that you can value, and you want to be confident that you're able to maybe have a second surgery, because you never know exactly what things are going to look like. And after that first surgery, then you can make decisions about whether you need something else or not. And I think the details about preserving the donor site are really critical. And then the hairline aesthetics that go along with it. You don't necessarily want maybe a tech or a non-physician or someone that doesn't have that same aesthetic touch to make those decisions. I think you want someone with the skill to do that.
They can potentially ruin your life, right? And on top of it, it's pretty dangerous too, because people, if you Google outside the country, people die on the table because there's no physician around, so the bleeding and all that stuff. But the main point is when we do it, it's about thinking not just for the now, but for the future of the patient. Right. And there's a reason why we limit to a certain amount, is to preserve the donor, so you can go back to do more. Again, it's a whole science and artistic detail when it comes to hair transplant. But thank you, Dr. Fulton, to share the experience with the audience and the viewer, and hopefully it will capture and the viewer to understand in depth about hair transplant. It's not just about result; it's more than just that.
Yeah, I think the highest aesthetic output quality that you can get with the least number of donor grafts is what you want.
Yeah.
You want to have the least number required to get the result. I think that's the best thing to do.
So that's why our transaction rate, the rate that destroy the graft, is very minimal. It's like 3% or less. Right, that's one. And number two, our growth rate is very high. You talk about from 90% up to 98, 99%. Depend on the follicle, how we do it. But again, that's why my surgery is long. Because I talked to one client who had it done outside the country. They say they start around 10 a.m. They have 1 hour lunch. They finish by 3. So that's 4 or 5 hours. FUE, I don't know, you remember our surgery? It's 12 to 16 hours.
Yeah, no, the experience for the actual surgery was very pleasant. And that's something you didn't ask, but that was extremely pleasant. It was, I think I saw a whole Netflix series. I don't totally remember, but it was, but the lunch and the planning and everything was very smooth.
Yeah. And we're trying to, have the patient be as comfortable as they can. So giving them Xanax and Valium really helpful. And of course numbing the patient. But we start with Versed too. And it's a safe, a small, very light dose, but it help. It's quicker. It makes the patient get sleepier faster, but they have a little amnesia effect.
Right.
So they forget a little bit unpleasant experience. So anyway, but thank you again for coming back a second year and share your experience and to see how you are right now and start from before. It's a night and day change.
Yeah, thank you.
Thank you.